So let me introduce myself. My name is Polian Lim. I'm the lead for biorisk management at the ACHS Center for Health Security. I'm an adult infectious disease and public health physician. I'm the director for the high-level isolation unit at the National Center for Infectious Diseases in Singapore. And I also head up the Travelers Health and Vaccination Clinic. So I wear a number of different hats. And I've been interested in outbreaks for a long time. So this is very much a topic near and dear to me. I was the former chair of the WHO HSI TAG, the Health Security Interface Technical Advisory Group, and the current vice chair, which was actually where I first met Filippa. Next slide. So Filippa is an associate professor or reader in Science and International Security at King's College London, where she actually has a joint appointment in the Department of War Studies and the Department of Global Health and Social Medicine. So that's a very wide range. She's a biologist and social scientist by training, and her research critically examines biological threats, health security, biorisk management, and biological arms control. She's also got an appointment as senior researcher in the Stockholm International Peace Research Institute, and she's a scholar at the James Martin Center for Non-Proliferation Studies. She chairs the WHO Technical Advisory Group for Responsible Use of Life Sciences and Dual-Use Research, which goes by WHO Rules DUR, and she's a member of the HSI TAG as well. She's a rostered expert with the UN SGM, the UN Secretary General's mechanism for investigation of alleged use of chemical or biological weapons. And on the Biological Weapons Convention, she's the NGO coordinator and a member of the UK Biosecurity Leadership Council. So I can't imagine a more distinguished and internationally recognized leader in the field of biosecurity to anchor our inaugural ACHS webinar series. So we are delighted and privileged to welcome Filippa as our speaker tonight. Filippa, go ahead.
Well, hello, everybody. Greetings from a rather wet and grey London. But I guess that's the authentic way to think about London, especially this time of year. Thank you, Polium, for your very generous introduction and for the invitation to speak at this inaugural webinar. It's a great privilege to do so. So thank you very much. We are living in very turbulent geopolitical times. And I think centers like the Asia Center for Human Security, where the regional, but also the larger international community can meet and exchange views is more important than ever. So it is a particular pleasure for me to be part of your inauguration activities. Today, we're, as you can see on this slide, talking about a very contested topic, human-made pandemics. Clearly, we all agree we don't want them, but there are differences in approach to how we avoid them. So what I'm going to do today is set out a framework that was developed by an international expert group, which I co-chaired alongside Jesse Bloom. But before I get to that, I guess more technical perspective on how we could potentially deal with the risks of human-made pandemics, I'd like to provide some short framing remarks. Next slide, please. So you may know that this week started the, we're going back a slide. Yes, thank you so much. Earlier this week started with the World Economic Forum dialogues and discussions that usually happen once a year at this time. And as part of that, the World Economic Forum, the WEF, produces a report called the Global risks report. And this year was the 20th edition. Now, the report identified the biotechnology sector, or the life sciences essentially, as the sector that's experiencing the most rapid technological advances. It asserts that, and I quote, "While global risks stemming from the field of biotechnology are not top of mind today, they will become so within a decade." The report devotes an entire section to biotechnology, as you can see highlighted on the slide here, titled "Losing Control of Biotech." So that is a major concern being raised in one of these very elite political international fora this week. So what are the risks coming out of biotech? What is it we are worried about? Next slide, please. I should start by saying that we all appreciate the tremendously important part that biology and biotechnology and the life sciences play in the portfolio of global biomedical research. This kind of research, biomedical research, is the means by which we identify the causal agents of infectious disease, the way in which we understand how they work, how disease is transmitted and acts in human bodies. And it's also the way we can devise strategies to prevent infection or mitigate the effects of disease. But the very tools that enable the discoveries of biologists and life scientists studying important human pathogens also creates potential risk. Now, some of these tools are simply the old school stock in trade tools of classical virology. So, for example, collecting and culturing viruses from nature and assessing their properties. Other tools are ones that biologists and life scientists have had access to for some time, but that are accelerated by the constant advance of biotechnology. So, for example, the ability to engineer DNA in the lab, to change genetic sequences, or modify or manipulate genetic sequences, and to determine the consequences of that change. So this is facilitated by improved methods of cloning, greater access to synthetic DNA, mostly from commercial sources, as well as the development of systems for converting that DNA into active virus. As with most developments in biotechnology, these start out as capabilities requiring substantial expertise and therefore have limited access, but soon they become democratized and more widely used across the global life sciences research enterprise. Importantly, there are now tools that we're only beginning to understand how they will be used in biological research. So, for example, the astonishingly rapid rise in the capabilities of artificial intelligence and machine learning, particularly things like the large language models we're seeing, have caught most biologists and life scientists by surprise. And we need to understand how they can be used to further research, but we also need to understand how they might be misused and how they might provide new tactical or strategic advantages. And you will also see that much of the talk in the WEF report, as well as much of the talk in the United States and the new incoming Trump administration, has been around AI and investments in AI, and certainly the Asia region is no stranger to the development of AI. So this is a big focus, and its intersection with biology and the medical sciences, life sciences, is of particular interest. Now, the risk of application of these three buckets of tools that I've been outlining, and the risk of that resulting in the creation of the accidental or intentional release of an agent that could cause widespread disease, possibly many deaths, is relatively low. And that But the risk is real, and that needs to be acknowledged and it needs to be addressed. So next slide, please. We know that the risk is real. Next slide, please. Here we go. Because there have historically been accidental releases from research labs that have resulted in infection and death of individuals. And we know the risk is increasing because today there are more laboratories and more people working with pathogens around the world than ever before. And my global biolabs team has been mapping the rise of all of these labs around the world. So we were able to provide the data to prove that there are now more labs, and with that, more people, more projects, more emphasis, and more risks coming out of that. We also know that there's more high-risk biological research going on today than previously. So large-scale viral prospecting, for example, or experiments that intentionally make dangerous viruses more virulent, more transmissible, are examples of particular high-risk research. Now, biologists and life scientists still know relatively little about how properties of pathogens, such as their virulence and transmissibility, are determined by genetic sequences. And most manipulations in the lab result in viruses that function less well. But more high-risk research activities mean more biosafety and more biosecurity risks. We also know that the risk of accidental or intentional release of high-consequence biological agents is real because there has been intentional release of biological agents that have resulted in deaths and mass disruption. For example, the 2001 Amerithrax case in the United States, which involved the release of the Bacillus anthracis spores through the mail or the post. Moreover, as some biologists and life scientists are aware, the US and the Soviet Union, among others, had substantial biowarfare programs in the 20th century, which deliberately researched how to make pathogens more virulent and more transmissible. Now, these programs were addressed by the 1972 Biological Weapons Convention, but there remains great concern that the ease of creation and production of these kinds of dangerous pathogens will cause others to seek them as a means of achieving desired ends. And sorry, we're one slide back still. You're running ahead of me. One more. There we go. We're still on this slide. I'll let you know when to change the slide. Thank you. And finally, the openness and the interconnectedness and the digitalization that we are seeing throughout the world is facilitating access to the innovation ecosystems, including in the life sciences. But we also know that industrial espionage takes place. We know that cyber theft takes place. We know there's academic infiltration. And we also know that there's early stage investment in startups, all aimed at accessing the science and technology innovation space. So it is important that we address the accidental, the inadvertent, and the intentional risks of global biomedical research. Next slide, please. Next slide, please. Now you went one too far. Here we go. That's right. So the WEF report on global risks that I mentioned earlier notes that, as you can see on the screen, that it's becoming easier for threat actors to make use of advances in biotechnology to modify or create new biological agents, which, if released, could lead to pandemics or be used in targeted biological attacks. There is concern about rising accessibility of biological weapons. The report states that advances in AI-driven biotech will make biological weapons easier and cheaper to develop over the next decade. The weapons themselves could be made more harmful than previous versions, or they could be different to those previously built in that they might eventually be focused on specific target groups of people based on genetic characteristics, leaving other people unharmed. And the report claims that attaining and building out biotech leadership is likely to rise up the agendas of leading militaries. Now, these claims are not necessarily claims that are new to someone like me who's been in this field for a long time, and I'm sure some of you as well who have been focusing on this. But it is new to start reading about this in these more mainstream sorts of reports, especially ones that are targeted at such a high political level. Next slide, please. Thank you. The report also draws attention to another concern that we've heard less about in international security policy discourse, and that is the potential for those with access to leading biotech to cross ethical boundaries. The report states that unless comprehensive global ethical boundaries are set for biotech developments, then ethical concerns are likely to be disregarded by some, leading to new sources of division and conflict within societies. So the World Economic Forum advocates for establishing a global ethical oversight body that consists of individuals respected worldwide for their humanity and ethical positions, as well as top minds on biotech itself, who are able to keep abreast of cutting-edge research and development and to help direct government efforts. However, pending such an intergovernmental agreement, which could take years, and I would certainly agree with that, a less ambitious objective for the short term would be to establish and agree on a set of broad norms to guide government policies on biotech worldwide. Next slide, please. Thank you. So this is what Pauline and I and many, many others have actually been developing together with the WHO, the World Health Organization. In 2022, the Global Guidance Framework for the Responsible Use of the Life Sciences was published after an extensive or several series of rounds of consultations with a wide variety of stakeholders and experts with different sorts of expertise. Next slide, please. What we did in that report was to delineate a set of values and principles to guide behavior in the very difficult and contentious space of dual-use life science research. And you see the list of values and principles that we came up with on the screen. Now, building on that framework produced by the international community, led by the WHO, the Bulletin of Atomic Scientists, which is a non-profit organization set up by the Manhattan Project scientists, nuclear scientists, after World War II, in order to engage on how science impacts society, essentially, and particularly on security issues. That Bulletin of Atomic Scientists set out to apply these values and principles in practice to a small, but arguably one of the most consequential parts of pathogen research. Next slide, please. And that small part of the wider remit of life science research was research with pandemic risks. So the bulletin established an independent panel of 28 international experts who had expertise not just in virology and related sciences like bacteriology, bioengineering, biotechnology, infectious diseases, epidemiology, etc., but also in fields like biorisk management, ethics, global governance and policy, security studies, even the odd sociologist like myself. So the remit of the task force was to consider potential benefits and potential harms of high-risk research on pathogens, but it wasn't all kinds of high-risk research. As I said, we had a narrow focus on the small subset of research that could plausibly source a large disease outbreak or even a pandemic due to accidental or inadvertent actions during research, or research that results in information that could be misused by malicious actors. In other words, our focus was on the potential for man-made pandemics. And these were man-made pandemics caused either accidentally, inadvertently, or intentionally. Next slide, please. Our scope included research on pathogens known to be capable of causing a pandemic, that under current conditions, for example, with low population immunity, could result in extensive spread beyond the current infection burden. Our scope also included the manipulation of pathogens that are not currently thought capable of pandemic spread in ways that can be anticipated to increase their capacity to cause a pandemic. So, for example, pathogens that were manipulated to increase their virulence, or pathogens that were deliberately manipulated to increase their transmissibility. Our remit also, or our scope also included research on newly discovered pathogens with unknown characteristics. So pathogens, for example, that had taxonomically close relatives that included potential pandemic pathogens. So in other words, we looked at research with known pandemic pathogens and at research with potential pandemic pathogens. We were asked or tasked to critically review the handling of these kinds of pathogens throughout the entire research cycle. So from collection in the field and transportation to sites for research, to characterization, cultivation, and manipulation in the laboratory, and then through to disposal at the end of that research. Next slide, please. Our starting point was that research with pandemic risks is qualitatively different to science that doesn't have pandemic risks. And this is because research with pandemic risks entails risks that could potentially harm very large numbers of people. In general, for science that doesn't have pandemic risks, so for the vast majority of science or life science work, regulation around occupational health and safety, which most countries have, tend to adequately weigh the direct biosafety risks to researchers in the laboratory. But biosafety standards and the implementation of those biosafety standards are unevenly distributed across different countries, across different institutions, and across different facilities. Now, rapid advances, so usually the biosafety regulations are good and are in place. Sometimes they're not always implemented as they should be, but generally we have, normal biosafety under control. But rapid advances in virology are also opening up new types of risks that still need to be incorporated into these established biosafety frameworks. And when we focus research on known and potential pandemic pathogens, we need to consider how it may affect the health of large groups of humans or other animals, not just the researchers in the lab. So our focus shifts from just making sure that the researchers that are working with dangerous pathogens in the lab are safe, to also focus on the much wider community beyond laboratory. So our view was therefore that research with pandemic risks warrants additional precautions, including what we term traffic lights, guardrails, speed bumps, and lampposts that would then illuminate safer directions for research. That was a nice metaphor that we used, but actually, what do these traffic signals, guardrails, speed bumps, and lampposts actually mean? What more specifically were our recommendations for this framework for tomorrow's pathogen research? Next slide, please. Our task force's overriding recommendation was that when there is potential for harm to large number of people as a result of research with pandemic risks, and especially where it's questionable whether those at risk will benefit from the research, then additional oversight, simply beyond simply the standard occupational health and safety regulations, is essential. So a more elaborate risk assessment than is currently done is needed. Moreover, research with pandemic risk should have high probability benefits for public health. You only undertake such high risk research, or you only undertake such high risks if you're confident that there will, in the near term, be some tangible public health benefits coming out of it. That is the only real justification you can have for undertaking such high risks, right? Next slide, please. Our task force was of the view that researchers and their institutions have an obligation to identify whether the risks from research with known and potential pandemic pathogens are proportionate to the potential benefits of the research, and to assess whether less risky forms of research could be equally beneficial. So that is an obligation that we felt the researcher was on, the onus of that was on the researchers and their institutions. So not only is there an ethical obligation to minimize the risk of harm by using less risky alternatives, such as surrogate systems, but there was also an ethical obligation to correct inequities in benefit sharing and research burdens. Again, this is drawing on those WHO values and principles that I showed you from the Global Guidance Framework on Responsible Life Sciences Use. For research with pandemic risks, where the stakes are higher and the inequities of harm-benefit distribution across stakeholders are greater, researchers and their institutions should not be the only ones that are conducting harm-benefit assessments. So yes, the onus is on the researchers and the institutions, but other stakeholders also need to be involved. We argued that a broader range of stakeholders should therefore be consulted in these harm-benefit assessments of particular pieces of this high-risk research or research with pandemic risks. In cases where it was found that there's not a proportionate harm-benefit ratio, then researchers and their institutions have an ethical obligation to respect prohibitions on that particular piece of research. Next slide, please. The bottom line is that research with pandemic risks should only proceed when the research community and relevant oversight bodies can demonstrate that the research will be conducted safely, securely, and responsibly, and demonstrate that no alternative and safer research could reach the same public health ends. And finally, provide adequate assurances of substantial benefits expected in the near term with a plausible plan for equitable global distribution of these benefits. Additionally, we would want regular reporting to national authorities of significant biosafety and biosecurity incidents as a requirement to all institutions conducting research with pandemic risks. Next slide, please. We believe that effective legislation, regulations, policies, and guidelines specifically regulating research with pandemic risks and addressing the points that I've just been making will strengthen the scientific enterprise. Getting greater clarity about the work that does not require special oversight would reduce uncertainties among researchers and then streamline the research process. We believe that these formal, or the task force believes that these formal governance measures should be put in place without delay, but and that they should, of course, cover the entire research cycle, and that research on pandemic risks should be monitored locally, nationally, and internationally. We recognize that there's no one-size-fits-all approach, that each country needs to consider resource availability, sensitivities, and public health priorities in creating policies that are appropriate to the local context. The standard, however, should be to aspire towards a state in which concern for minimizing population-level risks of accidental pathogen releases or misuse of research results is an automatic and is universal to researchers, as current norms about ensuring the proper treatment of human research participants is already. Until we have those kinds of formal governance measures in place, however, we believe that informal governance, so through things like professional norms, codes of conduct, standard operating procedures, and so on, should be harnessed to provide that norm-setting standard, echoing to some extent, I would say, that WEF report that was arguing for not just this ethical international body, but also these standards. So I'm nearing the end, Paulium. I know we are getting short on time, but I just on the last slide, next slide, please. This is my final slide. I wanted to say that the overarching aim of the framework that we presented for how we view tomorrow's pathogen research is to create a safe, secure, and responsible research environment for all researchers, and in doing so, earning public trust. The report was released about this time last year. It is readily available online. Please do go and read it. And please allow me just two very short final plugs before I hand back to Paulium, to say that, you know, work in this area does continue. We have a special issue of Applied Biosafety, the journal Applied Biosafety, coming out, guest edited by myself and others on biosafety, biosecurity concerns for potential pandemic pathogens and dual-use research of concern, to which we have not just one, but several contributions from Asia, which we are so pleased to have. It's so important to get voices from the different regions of the world as part of this conversation. And the second plug is that I'm collaborating with the Volkswagen, you'll know the car, the VW. They have a separate philanthropic arm which sponsors scientific conferences. And we are having a conference in Hanover in Germany in October, which will also cover these kinds of extreme risks, certainly potential pandemic pathogen research, also issues around AI, as well as mirrored life. So with that, I'm looking forward to your questions, and I'll hand back to Paulium. Thank you so much for your attention so far.